Assalamu alaikum everyone and welcome to my channel Study Made Easy. Today we will see that what is the role of physiotherapy in case of COVID patients. We will briefly discuss this topic. So before going to the main topic, let us discuss what is the COVID-19. So it is the pathogenic virus which not only attacks on the gastrointestinal tract but also the respiratory tract, and it causes infections which starts from common cold and can lead to more life-threatening diseases. For example, Middle East respiratory syndrome and severe acute respiratory syndrome. It is divided into four major groups, that is gamma, delta, beta and alpha. Keep in mind that gamma and delta type coronaviruses are more infectious to birds, but alpha and beta viruses are more infectious to mammals, so that too we humans. COVID-19 pandemic was started or firstly identified in the Wuhan city of China. The outbreak of pneumonia began at December 2019, which drew global concern because of extremely pathogenic and contagious nature. It is isolated as the fifth documented pandemic since the 1918 flu pandemic. It was officially called severe acute respiratory syndrome coronavirus 2, which mainly caused the COVID-19 disease by the International Committee on Taxonomy of Viruses. It is officially declared by the International Committee. So, what differs it from the other respiratory viruses is that its human transmission generally occurs within 2 to 10 days, preceding to individual turning symptomatic. SARS-CoV-2 remains attainable for at least 24 hours on hard surfaces and up to 8 hours on soft surfaces. 80% of the cases are mild or symptomless, while the 15% are acute and only 5% are critical. Now we will see that what is the role of physiotherapy in case of COVID patients. Physiotherapy plays a great role in patients, providing treatment like exercise plan, mobilization techniques, as well as rehabilitation. The goal is to rehabilitate them and attain maximum functionality of patient bodily systems. Symptoms like fever, loss of smell and taste, headache, fatigue, dry cough, dyspnea, nasal congestion, and muscle pain are the most common symptoms which occur in the COVID patients. These may vary in different or within an individual by time, depends upon the progress of infection and immune function. Now, how can we prevent this disease? As we all know that prevention is better than cure. One should wear masks and gloves, follow social distance, avoid social gatherings, meditate himself, and follow good hygiene operations. And the most important thing, exercise. Because exercise not only helps us to maintain a routine, it also helps us to keep our respiratory tract work efficiently, and it can also help our lungs physiology to be maintained. All these things will help to boost our immune system, which can prevent pathogenic attack to body systems. It also affects our mental health. So exercise is the main way of prevention. Exercise techniques includes early mobilization of patient with respiratory disorders. So mobilization techniques mainly includes body posture changes which can facilitate breathing, that is our respiratory system functionality. Simple exercises in bed lying down with mobilization of upper and lower limbs can be beneficial in case of paralyzed patients. Same, we can perform the sitting and standing exercises. Stability and flexibility exercises of lower limbs is again important. The goal to attain the daily living activities and its training is again very important. Aerobic exercises can be performed up to 20 to 30 minutes. Respiration control techniques includes deep breathing exercises, stacking techniques, secretion management, and postural drainage. Few are the warnings which should be kept in mind. That is, patient participation must be considered, otherwise, exercise could be ineffective. Hydration is very important. And lastly, the patient should know methods of exercise control. So, patient education is very important. Instructions must be reminded to patients. So, bed exercises includes the movement, circumduction, rotations, flexion, extension. All these are the common movement exercises, and we can perform them in the sitting position as well as in the standing position. In standing position, our main focus is on the hip joint, while on the sitting or lying position, our main focus is on the upper and lower limbs movements like the shoulder joint and knee joint, all these. So exercises for stability and balance are the tilt of trunk, pelvis indirect, pelvic tilt, and hip rotations. All these exercises can be performed for stability, coordination, or balance. Treatment can help to increase lungs capacity, improve gaseous exchange, perform fitness exercises, and prevent immobilization. So it can help us to improve our gastrointestinal tract as well as respiratory tract.